Hi, Dr. Brown.
There we
Hi.
go. Hi, how are you?
Good. It's good to see you.
Nice to meet you.
Thank you for joining us today.
Of course.
Um,
Yeah.
so usually I just go straight into it.
Okay.
Dr. Brown, thank you for being here. Could you please share a little bit more about you and your work, and include your personal motivation for going into this?
Sure. So my name is Dr. Tasha Brown. I am a licensed clinical psychologist, and I work primarily with children and adolescents and their parents. And I always add the parents part because we know that children and adolescents usually come with an adult. And I believe that when we're doing work around helping a child and their mental health, it really involves the parent or the caregiver. So I always add the parent part.
Oh,
Um, I work primarily with children who have significant disruptive behaviors. So
okay.
work with kids who are having difficulties listening, following directions. These are the kids who are really having a hard time navigating like home, school, and community because of a behavioral difficulty, attentional concerns, maybe trauma that has led to behavioral difficulties. And I work in a number of settings. So I have a private practice part time. And for the other part of my time, I work in a hospital in the New York City area. And at that hospital, I do a program called Parent Child Interaction Therapy for children with disruptive behavioral concerns. And I also am part of the school based team where we see kids in their school because we know that when we're able to provide mental health services in the spaces where kids frequent school, we get to
Yeah,
see we can do more work with their teachers, their parents, and make mental health care accessible.
that's so interesting. So a family would actually work with the hospital system or the medical system that you work at, and then through that they would actually set up a way for you guys to do a push-in therapy at school.
Yeah, so
Oh, that's remarkable.
the medical system, we have like offices, which is like a room in every school, and they are patients under the hospital, but we do all of the services at school. So we pull them from their classroom, teacher, the parents come see us at school, we consult with their teachers, we do everything at school.
Oh, wow.
Yeah.
That's so interesting. I am very well versed in I'm a medical needs mom, and I had no idea that was possible. Every
Yeah.
time I talk to someone, I learn something. I always learn something. It's kind of amazing.
Yeah. It
Um,
changes the game, I think.
is there any personal motivation that got you into this work?
Yeah, I love that question. So when I was younger, I grew up in a really large church, and a lot of the families were like first like immigrants, like recently coming
Hmm.
to this country. Very big church, very involved. Like people know each other. And there was a family that came to the church, and I was a teenager. I was probably like 14, 15. And there it was a mom, a son, and an older
Hmm.
brother. And the little boy had significant behavioral concerns. And
Interesting.
so he was like really disruptive. And I was so fascinated with like all the adults trying to like lend this mom support, and everyone tried, like it was not working. You can tell this mom was really frustrated, looking for any type of support. And the adults around just really stuck on how to manage the behavior.
Yeah.
I was an adult at the time, but there's something about it that I was just like, what is happening
Yeah.
here?
Yeah.
Um,
Yeah. And you talk about how those behaviors are communication.
yeah. So um, I didn't know what a psychologist was. I was like, when I get older, I want to work with children like him. I don't know what
It's
that
so
would look,
amazing.
but that was kind of my like first
That's so
type
cool.
of population that I wanted to work with. Yeah.
That's awesome. I love that you can pinpoint it to a moment because not everyone can. So I really appreciate you sharing that. I know that one of your focus areas is ADHD. What are the signs of ADHD that you wish parents knew about, given that a lot of times it's diagnosed late?
Yeah, I think that's a really important question. I think ADHD is one of those diagnoses that is very often like misunderstood by a lot of parents and caregivers just because there's a lot of like pop culture type of conversations about ADHD that has some truth and it doesn't really have the whole big picture.
Okay.
So the first thing I always want parents to know is that there are actually three different types of ADHD. And so
Hmm.
a child or adolescent gets a diagnosis of ADHD, or even an adult gets a diagnosis of ADHD, they're not just going to say you have ADHD, period.
Okay.
They're saying, you have a diagnosis of ADHD, an attentive type, which is very
Okay.
different than the diagnosis of ADHD hyperactive impulsive type. Or they're going to say you have a diagnosis of a combination of the two. So we know that those inattentive symptoms are difficulties focusing on tasks for a long period of time, difficulties with shifting your attention. And so you may be really into one thing and a really hard time like staying focused on this one thing because all the external stimuli is having you really distracted. Um, those are some of those inattentive symptoms. The hyperactive symptoms, I think, is what people like stereotypically think about ADHD.
Yeah.
This is
Yeah.
a child who's like bouncing off the walls, having difficulty sitting, really having a hard time like monitoring their volume and talking excessively. Those are some of those hyperactive
Hmm.
symptoms. And then there are children who show a combination of both the
Okay.
inattentive symptoms and those hyperactive symptoms. And so there's a combined type of ADHD. So I always like to start there that when
Yeah, that's helpful.
diagnosis of ADHD, you're thinking, okay, my child is having attentional difficulties. Your child could be never not hyperactive, always sitting in their seat, always on task,
Yeah.
and still meet criteria for ADHD because they're really struggling with those inattentive symptoms. And we know a lot of
Okay.
times the attentive symptoms, they kind of slide under the radar. They have difficulties in school, their grades are slipping, but because they're not disruptive, they're
Yeah.
not getting that the children who are a little bit more hyperactive would get. So I always like to
Yeah.
start there.
And I mean, one of the things that I understand is like it's hard to know what a child is going through because sometimes their behavior is different at home than it is at school. What are ways that parents can figure out if there is something that needs immediate attention from a
Mm,
specialist like you?
yeah, that's a really great question. One of the things about ADHD that we know to be very, very true is that it doesn't just occur in one setting. So if your
Okay.
child has the definition, like true diagnosis of ADHD, you're going to see it in multiple settings. But you're bringing up a really great point is that it may look different at school than it does at home because like the demands are different. And so if you go to your pediatrician, I always say that's a really beautiful place to start. Saying like, my child is having some difficulties with focus and attention, and your pediatrician may give you like a rating scale or do like a really quick interview with you in terms of like what are some of the symptoms that you're noticing. There are some measures like the Vanderbilt
Mm-hmm.
that they'll send home with you. And the great thing about the Vanderbilt, and I think it's like standard practice in a lot of different pediatricians' offices, is that they give the Vanderbilt, and there's a parent version and there's a caregiver version, and you can give that to as many people as possible. One of the
Oh, that's interesting. Yeah.
yeah, when you get, so say if you go to your doctor or your mental health professional and they're like, here, fill out these forms, I always tell parents to ask for multiple. So if there's a teacher form and you know your child, there's two teachers in the classroom, or your child is engaged in after school activity, or there's multiple caregivers at home, I would grab a few. They print them out and just
Okay.
say, it would be great if multiple people in the house could fill this out so we can get an accurate reflection of how this child is functioning across settings. For
Okay.
children with ADHD, what we'll see is that different items may be elevated. So one person may say difficulties listening. We see that sometimes. Another person at school may say we see that all the time. And someone at dance may say we see that seldomly.
Hmm.
That gives like a really bigger picture than just asking the teacher or just asking a parent. You want to make sure that we're kind of touching on as many people as possible to get um, a really full understanding. So ask for scales that you can bring to your teacher or
Okay.
to a caregiver at home. And most pediatricians and all mental health professionals should be using like a standard scale that you are filling out to help make like an accurate diagnosis.
And
Um,
Vanderbilt is the most common one, right?
yeah, the Vanderbilt is like the most common, like gold standard. You should be able to find
Okay.
it.
Okay. And then it's on the pediatrician to collect, kind of aggregate those different caregiver questionnaires, right? And then the parent should ask based on that, like for a referral, like what's the step after they go to their pediatrician?
Yeah, so you can start with your pediatrician. The pediatrician, depending on the pediatrician's office. So there's a few things. You can ask your pediatrician, is there a way for me to get a behavioral health consultation? So if you really think that there are attentional ADHD concerns, you can tell your pediatrician about it. They'll do some assessment, but a lot of pediatricians offices, especially now, are moving towards having this very inclusive type of care where there are lots of different providers available to their patients. And so
Okay.
is mental health consultant or someone, a psychologist, a licensed clinical social worker that I can have a behavioral consultation with. Um,
Okay.
and if your pediatrician has that, it would be great for you to talk to that person. Very often they'll like come right into the room, or your pediatrician can like set you up with them
Got
directly.
it. Okay.
Um, the pediatrician will maybe give you the Vanderbilt, but realistically, especially now when pediatricians are like slammed,
Hmm.
um, I think sometimes it's hard for them to keep up with the like scoring them and then feedback. And it's not because a lot of parents will get really frustrated, like they don't care. It's the system is so large in terms
Yeah, it
of the,
is.
it's just hard sometimes for a pediatrician to follow up on those behavioral things. So in the moment, you should ask for a referral. So is there a psychologist, a licensed clinical social worker somewhere in this hospital system or medical system where I can get more specific support for my child's behavior? And leave that office with a list of referrals for mental
Okay.
professionals.
Okay.
Another route, so you can go the pediatrician route. Another route you can go is the school route. You can talk to your child's teacher. You can talk to the school support team. So there's usually a school psychologist, a guidance counselor, a social worker. There's people at school whose job is specifically to kind of think about your child's mental health as it relates to their functioning in school.
Okay.
And a lot of times schools will have a list of people in the area that they recommend for students.
Got it.
Your friends and your family members, because not, it's not often, I think this is changing, but your neighbor, your child's friend may be having similar difficulties,
Yep.
and they may have a really great clinician, and their parent may have someone that they love. And there's a lot of stigma around talking about your child's mental health, but
Yeah.
tap into your network of other parents and ask for their suggestions, because it always feels really good to go to someone where you can say like,
You
oh my,
know.
right,
Yeah. It's
right.
funny, like I started Sleuth based on what I've been through with my daughter, and I'm fairly open
Mhm.
about the journey. And it's interesting because every time we have a conversation with someone, they're like, "Oh yeah, my child dealt with this." It's almost like an opening.
Yeah.
And especially since COVID,
Mhm.
I appreciate what you're saying, because one of the kind of hard realities is that children are kind of impacted by what's going on in the world. And there's nothing wrong with it. Just like adults, they have needs that need to be addressed. And so I appreciate you endorsing that we should be talking about how we're doing, because I think it is a community effort. It is such a community effort, right, to get everything our child needs.
Yeah.
Um,
Yeah. And even like once you're getting services, like just to have the support of another parent or a caregiver or someone who's really close to you to kind of provide the emotional support as a parent that you,
yeah.
as you navigate your child's mental health care is so important. And so the earlier you start those conversations, the more open and vulnerable you are in those conversations, it can be extremely beneficial for your family functioning as a whole.
Right. Because otherwise, it also feels really lonely. It feels like, oh my gosh, we're dealing with this thing. And when we go outside, we have to pretend like everything is normal. But when we go home, it's a very different reality.
Yeah.
I feel that my daughter has a totally different medical condition. And I feel that very, very much. It's like, and so it's a lot to explain to people. But oftentimes when you do share it with people, people will come and support. So.
Yeah,
Uh,
definitely.
Amongst younger children, what are the signs of ADHD that you wish parents were informed about that they could take earlier action? And you mentioned the three different types, but what are the most common symptoms that you see that we might not know about?
Mm. So I think I'm thinking, I always tell parents to think like developmentally. So
Okay.
we know that by the time a child is like 4 or 5, their attention they should be able to hold their attention on like a book, a short child's book, or an art activity or something for longer periods of time. And a
Okay.
lot of parents will say like, oh yeah, my child can't make it through like a 10-page book. Like there's no way we're even making it through the third page because like they're up and they're doing something else. And that can be a sign of some attentional difficulties. And a lot of times parents dismiss it as like, oh, they're like 6, like they're supposed to be.
Oh, yeah. Yeah.
Um, so looking out for some of those just really difficulties, staying focused on certain things, especially as the older they get. So the way that they were able to focus on a story when they're 4, by the time they're 6, they should be able to focus for a lot longer periods of time. And if you're not noticing that progression of being able to focus, being able to complete tasks, being able to follow multiple step commands. So, for instance, if you say, please pick up your shoes and put them by the door, your child picks up the shoes and then before you know it, they're like off doing something else. For children with ADHD, it's not because they're non-compliant. They probably really and most likely want to listen, but by the time they pick up the shoes, they are walking to the door to put them down and then they saw their toy or someone said something and then they got distracted. So if you're
Yeah.
noticing difficulties like following multiple part commands, that may be a sign that your child's having difficulties with attention. I always say like if you put out a group of toys and your child is just like bouncing from one thing to the next, and they're not able to like stay focused on one activity for a significant
Yeah.
time, that also may be a sign that there's some attentional difficulties. And it's I think taking note of that. And the biggest thing is when those things start to interfere with everyday functioning, parents
Okay.
usually that's when it's really important for you to be like, kids are developmentally going to have some attentional concerns. Sometimes parents will say, yeah, my child has had these attentional difficulties since I could see it since they were 4, and it's been getting in the way of schoolwork, like the teacher was calling, or I was never able to get through homework. If you start hearing yourself say some of those things, to me,
That's
that's
very helpful.
time to get some support because now the attentional difficulties are interfering with everyday functioning.
Okay.
So every single time you tell your child to do something and they're getting distracted and it's taking you forever to get out of the house in the morning, or you're finding yourself yelling a lot or screaming a lot, that's a sign that it's getting in the way of your everyday functioning. And then it may be time to get some additional support.
Got
Um,
it.
so
Yeah,
when,
that's very helpful. So the line really is when it impacts everyday functioning,
yep,
like at a certain point. Okay, because there might be people who I'm thinking of my daughter, that might get a little bit distracted, but it
Yeah.
doesn't necessarily affect her everyday function.
And
Um,
and we know it's appropriate for children to become distracted, be a little hyperactive
yeah.
sometimes. Is that's children, and
Okay.
some kids, like based on their personality, they may a little bit more. But there are certain kids, like they may be distractible, they may be inattentive, and they're still getting really great grades. They're still able to get through the day.
Yeah.
And other kids, not so much. And
Okay.
so when you're saying like, whoa, this is really getting in the way of living, um, even if it's like even if it's something that you consider like minor, I would say it never hurts to just bring it to the attention of a teacher, a pediatrician,
Okay.
someone that could provide some additional support.
And what are the interventions? What do they look like once a parent's new to the journey? What can they expect that it
That's a
means?
really good question. So that's going to change based on your child's age. And it's going to change based on your child's age. So when your child is younger, a lot of the intervention around ADHD, and this usually throws parents off, is actually they call it parent management training or parent consultation. Because I always like when children have symptoms of ADHD, like they're not doing these things on purpose. They genuinely are having um, a hard time. And so the adults around them need to create an environment and a structure that helps keep the child on track and also helps keep the child focused and helps the child learn skills to
Got
manage.
it.
And so a lot of the early treatments for ADHD for younger children is going to involve lots of parent work. So we're teaching how to do behavior charts, how to set up routines and structure, how to set up effective discipline. So parent-child interaction therapy is a great
Okay.
therapy for children with ADHD, incredible years, but all of those things are focused on parent management training or parent consultation. We're really talking to parents about what are some things that we can do to help your child be successful at school. What are some concrete skills that you can implement at home? So,
Okay.
teaching parents about structure and routines, reward charts, we're teaching about like special time. So this daily like play therapy type of situation that you can set up at home daily with your child. That's what we're teaching.
Got
As
it. It sounds like coaching. It sounds
yeah,
like a lot of,
yeah,
okay.
yeah. In parent-child interaction therapy, we actually call the therapist is called like a coach. Like that's the language
Okay.
in that treatment model. In as your child gets older, ADHD treatment can all then start to include therapy specific for the child, where you're teaching them explicitly some emotion regulation skills. You're teaching them how to organize. We call it organizational skills training because we
Okay.
know ADHD really involves like this part of our brain, this executive
Okay.
function.
Yeah.
So we're teaching kids like how to keep your desk tidy, how to like write down things on a list so you know what you need, ways that you can stay focused in class, how to follow the schedules and routines that your parents are setting up. We're really focused on some of those things with younger children, teaching that, well, when they get a little bit older, teaching them their different feelings and how to express their emotions, talking about helping them identify their triggers, giving them some kind of like some coping strategies.
So it sounds like also a lot of self-awareness.
A lot of,
Self-awareness, and then what do you do when you are aware of something?
yeah,
Okay.
I know that a big part of ADHD is being as impulsiveness. And so children who have ADHD will like say things and do things in a very impulsive way. And we
Hmm.
build as much awareness and self-awareness as possible. For some children, a social skills group can be very beneficial.
Interesting. Okay.
Children who have significant ADHD, when they get to like that third, fourth grade age, a lot of their impulsive behaviors, sometimes their attention seeking behaviors, will then get in the way of being able to develop and maintain friendships. And so we want to teach kids
Yes.
concrete
Yeah.
skills around how you can navigate
Okay.
situations. And then older children, like teens, we're really focused in on that organizational skills training. Sometimes parents will work with like an executive functioning coach or someone who's specifically trained to work with children who have ADHD to help with their executive functioning. And then, of course, there's the medication management
Hmm.
portion where you would work with a psychiatrist. For some children, like medication management is really effective in helping to monitor and manage their impulsive, like inattentive symptoms. The
Got it.
research is actually very clear about this, that um, we see the best outcomes for children who have a combination of therapy. So that could be the individual therapy, parent management training, and some sort of medication management. Um,
Okay.
Remember, the ADHD is really this biological, it's a neurological condition. So it's the medication really helps bring some of these things down that's happening, some of the hyperactivity, some of the intense inattention, so that you're able to then use the coping strategies and use the skills that you're learning in treatment.
Yeah, that's so helpful. We have a question. How can someone navigate a conversation if you feel a relative's child has ADHD and you think they should get help? It's a great question. Thank you.
Hi, Bella. Thanks for that question. Whew, that's a hard question. um, I think if you are really concerned about a relative's child, it can be really sticky. People get really like lots of walls up when you start to talk with them about their children and something being wrong with their child. And so I would always come from it from a position of as non-judgmental as possible. And so I'm coming to you with this concern because, you know, I really love you and I love your child and I want the best for them. And I'm noticing these things. And then maybe direct them to a resource. Like, here's an Instagram live that I watched, or here's some resources that I found, or a podcast that I listened to, just so you can kind of maybe, if you choose, hear about some things that um, I'm seeing in your child that may be related. A lot of times the conversation like gets stopped because then it becomes about what the parent is or is not doing. I would shy away, like not bring that into the conversation. Like, this is happening because you are giving them too much TV time, or you're not doing this. I would keep it strictly on like things that you have seen and come with some resources so that it can be a productive type of conversation. And honestly, parents will say to me a lot, like a lot of people have always told me this, and I know that like I knew it, but it was just hard for me to accept during the time, or just hard to hear another person say it. And so parents usually know. You're not usually bringing something
Hmm.
to them. They know. So
Yeah.
with resources, so that the thing that they already know, you're coming with a way that you can provide supports for them.
Yeah, it's a great question. We will also, our website has some stories on ADHD, but in the next couple months we'll have more. In situations where, you know, not when it's about ADHD, but let's say I think someone's child might have a speech delay, I will often reference another story and see if that's like an in and say, oh, I knew a family that did this and they did this, and you know,
Mm-hmm.
and sometimes having a third person story is like a neutral way to broach the subject too.
Mm-hmm. Yeah.
Um,
Or your own.
I, yeah, yeah, completely. Um, the next question I was going to ask is, what is the impact of, or what, let me rephrase it. What is the benefit of getting a diagnosis sooner rather than later? What does the child get if they get earlier intervention versus, let's say, in their teens?
This is such a great question. Early intervention is like key. Where we can talk about early intervention for lots of different.
Yeah, yes.
So I think that's such a great question. It's such a loaded question too, because there's the diagnosis part, and sometimes like having a conversation on like, why do we actually need a diagnosis? Because parents will like stray away from like, well, I don't want this in their record. I don't want the school knowing. What that diagnosis is going to do is going to give your child services. And when we think about let's take it from like a public school perspective anywhere in the United States. Your child, if they have a diagnosis of ADHD, it's documented by a medical professional. You have a 504 plan or an IEP. Your child is legally mandated to get certain services from their school. So that could be extended time on their testing. That could be preferential seating. That could be someone pushing into their classroom and teaching them some of the skills that I just talked about. That could be someone pulling them out of their classroom. And those services in the school building is going to help your child to perform better academically. Your ADHD and cognitive functioning are two separate things. A lot of times children will be able to perform extremely well. They're getting A's, B's on everything. And by the time they're getting to like the third grade, we're starting to notice like their grades are slipping a little bit. And for children with ADHD, it's not because they're not understanding the material. It's not because cognitively things are going over their head. It's because they don't have enough time, or they need someone to explicitly teach them how to write in their notebook in a way that they're going to be able to go back to and understand. Or they need someone to break down how to organize, like writing a math problem out so it's not all over the place. And a diagnosis is going to help get your child those services in school. It's hard to say, hey, can you please pull my child out for this? Give my child extra credit without a document saying they need this.
Yep, that makes so much sense.
That documentation, that diagnosis is key. And a lot of parents are like, well, I don't want my child to get labeled. I don't want that stigma on my child. Your child is going to stand, if your child has ADHD, your child is going to stand out in the classroom setting. No, and so do you want them to stand out because they're saying, how can we push all these services towards your child? Or do you want your child standing out because like, well, there's something up with this child. We don't know what it is. We're just trying to figure it out.
Yeah. Yeah.
So I am such a big advocate about getting a diagnosis. And when I work with, particularly with the like families of color, there's lots of stigma around like, I don't want my Black or brown child like having a diagnosis. Like, what does that mean for them? And I think there's clearly lots of reasons why that exists, and that kind of fear and anxiety around having your child diagnosis is extremely understandable. And so I think a lot of times parents just need to have lots of conversations about what are the benefits of that diagnosis.
Yeah.
Like, who has ADHD with services looks very different than a child who has ADHD without. And remember, your child may continue to have ADHD symptoms well into adulthood. They're going to look different because they're going to be adults. But we want to teach them from as early as possible, how can they navigate when these symptoms come up, so you're setting them up for literally lifelong success. So it's a game. We know that
it's
a game changer.
I appreciate that so much. You are always predicting my next question, so I really appreciate this. My next question is, for families of color, what are ways that parents can advocate given, I mean, it's for anyone who feels systemic bias, for anyone who's in that position. What are things that we can do to advocate best for a child?
Yeah, that's a really great question. I think strong documentation is really important. So keep track of things like keep papers of your child's writings, keep lots of score on what their grade performance. If you've talked to someone about it at the school, I always say put it in writing and then document, like, I've talked to you at this time regarding my child's concerns. This is what we discussed. Here are the solutions. Follow up. And know that as a parent, you don't have to wait until the school comes to you or a medical professional comes to you about the concern. You
Okay.
can write a letter saying, I would like my child to be evaluated for special education services or an individual educational plan due to my concerns about um, his or her or their attention. And you literally can write that on a piece of paper, date it, and sign it and hand it into a school psychologist. And they have to legally start a process because you've
Oh, wow.
started that. And so there's so many things you can do to advocate for your child. I would say make a photocopy or take a picture just so
Yeah.
they know that you sent it in. If
Or
you need
like send an email like as
or
delivered by hand
yep,
today.
it's
Yes.
intended to follow up. There are a lot of agencies out there, depending on your state, that provide like educational advocacy. Just type into Google like free educational advocates. Um,
Yep.
my community, if the school is giving you a lot of pushback. And I talk about school a lot because if you have a child who has ADHD, you're definitely going to want to make sure they have some services at school. Same thing
Okay.
with pediatrician. A lot of times, some pediatricians may say like, "Oh, let's watch it. That may be developmentally appropriate," but you want to say like, "No, I need give me one of the measures. Can we please schedule me for a follow up in 2 months so we can talk specifically about this?
Yeah.
Is there a number?"
And the reason you're saying that is probably twofold. What, right? Like one, parents have observational data that they should trust their gut. And two, even if something is not, not diagnosable, that they're not to the point they need a diagnosis, at least you would have gotten attention immediately. So you would have started the process sooner rather than later if they do need services.
Yep, yep. And one of the things that I think, if you're over the age of 17 and you go to a psychiatrist or a psychologist and you say, I really think I'm struggling with ADHD or inattentive symptoms, part of their assessment is going to be, let's talk about how you were as a child and before the age of 12. Part of your adult assessment for ADHD is always going to include what happened as a child, because we know for most adults who have ADHD, I would say for all, these symptoms just didn't appear. They showed up in some way, shape, or form when you were a child. And so
Yeah.
um, the more data you have, the more you're going to be able to track your child's progress over time. And you're going to be able to kind of be
Yeah.
open, and there are going to be more services available.
Yeah. Yeah. I appreciate you saying that. I think it's so important, on the stigma side. I think the other side of that is that we can help our children be seen for who they are as the whole person that they are,
Yep.
right? And like, it's hard to have a diagnosis sometimes. There's a lot of discrimination out there, but as the parent and advocate, that narrative is also highly influenced by how we communicate to our child,
Yeah.
right? And how they communicate it back.
Yeah. And
One of the things, yeah,
sorry, can I just add,
yeah,
people want
yeah,
them to be able to advocate for themselves. And so
yes,
the more they see you advocating for them, they're going to learn like, oh,
mm-hmm.
whenever my mom noticed that my teacher didn't give me extended time, she called the teacher. And so maybe if I notice that my mom's not giving or my teacher's not giving extended time, like I should say something.
Yeah,
You're teaching your child how to advocate for themselves, like a skill that they're going to need for so many reasons.
so
Um,
many.
you advocate for them when they're children.
Yeah, totally. Thank you so much. You're so passionate about your expertise, and I really appreciate your time and what you're doing for families. I We are at Sleuth, we're a search engine for children's health, and in a couple of months, we'll be able to share a lot of data that we're collecting from parents themselves on ADHD. So I'd love for you to take a look, and maybe we can do this again because I know this is something that's important to so many of us.
Definitely. And I did a podcast episode a few weeks ago, honestly, at this point, like 3 weeks ago,
Yeah,
a
I saw.
part thing about ADHD. It's Notes from a Child Psychologist, and there's 2 episodes that really go into like what ADHD is, all the symptoms, and what you can do as a parent to start to support your child, and what next steps you can start to take.
It's so useful. So, so useful. Thank you. And thank you for everyone who joined. I will repost this as well, so it's always accessible.
Great.
Thank you, Dr. Brown.
Have a great weekend.
Too. Bye, everybody.